joint decision by nursing care staff to determine that Donna was not mentally fit to consent to sex, which Henry Rayhans agreed to.
Is someone with dementia and Alzheimer's usually okay to make small decisions?
A lot of times.
What about big decisions?
Not normally.
At 78 years of age, there was no doubt Donna Rayhans was lost in the fog of Alzheimer's. She couldn't feed herself, couldn't remember the names of her children, and was once found washing her hands in the toilet of a restaurant bathroom. Her husband, Henry, a loving man married to her since '07, visited her one day at the nursing home and had sex with his wife. He is now charged with a third-degree felony for sexual abuse, and a case involving consent and dementia has the nation riveted. Let's welcome to MidPoint the Director of Medical Ethics at New York University's Langone Medical Center, Dr. Aurthur Caplan. Dr. Caplan, good to see you again.
Hey, thanks for having me.
Here's the question. Should Alzheimer's patients be allowed to have sex?
I'm going to answer that with a yes, qualified. If you're going to risk injury, because they also have things like osteoporosis, bone deterioration, where they might be injured, if they're fearful, if they don't really understand what's going on, obviously, we've got to protect them against harm. But if it's a situation where they like being touched, they like the intimacy, many Alzheimer's patients do like that, just as they like their food and watching television, then I think we ought to try and maximize the opportunity to continue relationships that started with a loving marriage.
Part of this comes down to then the husband's rights versus the rights of the nursing home, I would guess, because he is her legal husband at that point. The nursing home apparently did warn him and say that there was a possibility she did have some severe Alzheimer's here and was forgetting a lot of things. But who gets the right at that point to make the decision, the husband or the nursing home?
Well, to me, it's the husband who's in a better position to say, this is what my wife would want, than the nursing home. They don't know her as well. They can look out for her safety. If they are arguing that sex for her is unsafe, okay. I think that has to trump everything else. But other than that, they're not married to her. They didn't live with her. They didn't know her prior to her admission to the facility. So I would say the husband, he's the one who's got the best sense of what his wife would say if we were able to sort of get her competent and say, do you agree to this?
See, there's competency that now comes into this. So when does the medical community get involved? When a doctor, a physician, a caretaker knows that the individual cannot make a cogent decision on their own, and then they have to make the decision for them. How does that happen? And where do you go from there?
Well, I don't think you go to court with a third-degree felony charge. You might have a family meeting. You might keep talking to the husband saying, look, here's our reasons why we don't think you should have sex with her. Maybe you can kiss her. Maybe you can hold her. Here's what we think is dangerous. Here's what we think might frighten her. Here's what we think, you have to worry about. And you try to work this out. What we're doing in court with a felony charge against this guy, I can't imagine, because I don't think that's the right place to be.
As you wrote in Medscape.com in your article, Is It Love or Assault?, you talked about the fact that physicians still don't feel comfortable about telling people about an Alzheimer's diagnosis, and they need a better plan for managing the disease. We just opened up a huge Pandora's box here. What is at least the beginning of that plan, in your opinion?
I think as soon as you suspect any cognitive impairment due to a stroke or Alzheimer's, whatever it might be, and you worry that this person is going to go downhill, a doctor needs to get planning started. What's the medical care going to be? How aggressive do you want your care to be if you can't communicate? And what sorts of things do you want to go on with your husband, with your family? Do you want visitors? Do you want to have sexual relations? It's tough to get these things talked about because people are squeamish about them. They don't want to talk about them. I'd say a lot of children don't even like to think about their parents having sex, much less their grandparents. We've got to get over that and plan this out.
About 15 seconds left, and are we looking at one day where we're going to have a document that will be signed out with somebody saying, if I am found to be such and such, then this is the decision?
Yes, I think that's where we need to head. We also need a conversation, not just a legal paper. Bring it up with your family, let everybody know what's going on so the children don't try and step in, get consensus using that legal document, but the conversation is very, very important.
Conversation's got to be had, and I love it when you say that the physicians themselves have to reveal the diagnosis, tell the patients, don't be afraid to tell them. Dr. Aurthur Caplan, always a pleasure, my friend. Thanks for joining us.
Thank you.
All right, take care. When it comes to loving, caring relationships between a husband and wife, there are those who fail to grasp the concept of always supporting your spouse, which leads us down the trail of another visit to Outland.